Good morning, guys. I would like to show you today one challenging case, a transplant details with the results. Kindly watch the video until end to understand why it is challenging and what we achieved with our meticulous plan. That's the story of this patient. Kindly watch the video until end. Well, having said that, it's a kind of a challenging case. Important factor is kind of patient has a very fair skin, and point two is he has hair loss in a receding line in hairline in the frontal area, and there is a prominent amount of hair loss has been lost in the crown area, vertex area, and as well as mid scalp also there is a hair loss. That is the reason I just categorize this patient as a challenging patient because and implanting and getting the results in frontal area and mid scalp and crown in single session, one day session, usually not possible in all the patients. That's the limitation of the hair transplantation, depending on the patient, like a donor and other things. Well, here fair skin makes a little advantage, disadvantage for the results. Number two, extending the baldness in the frontal area, mid scalp and crown, all three areas also again a negative point for surgeon and even patient. So these are the things. Well, while designing the plan, we made up our mind such a way that we need more grafts and try to get better camouflage in all these required predominant area. So especially in the hairline, we just take a little higher hairline to conserve some grafts so that we can implant those grafts in the mid scalp or crown. That's one meticulous plan we have taken, and this is a very smart plan, I would say, because if you can implant a centimeter down in the hairline, probably this case would end up in failure transplant. That's what the importance of the placement of the hairline. So, we designed hairline such a way that, and we have taken the hairline with a few calculations of the facial profile and designed such a way that we're going to conserve the grafts and as well as he's going to get best outcome of this transplant. Then, we had kind of best donor. So that also favored us to get good grafts, good quality grafts. We designed implantation in the frontal area and the mid scalp and crown also. So this kind of plan we implemented in this patient because there is a good donor. Probably it may not be possible with all patients. So because this donor is very good, we could able to get this kind of plan there. Well, surgery went very well. After 10 months, if you can see the results, excellent density in the hairline, excellent naturality, so that no one would understand that this guy underwent transplant, and excellent density in the mid scalp as well as crown also. Usually, this kind of results in one session may not be possible in all the patients. Kindly note this donor really makes an important key role to get such density. And second, how better we are going to plan the surgery. Planning means kind of where you're going to place the hairline, how much density you are giving in the hairline, how much density you are giving in the mid scalp and even in the crown, and what angulations you are going to make it. All this really matters to get a better camouflage. That's what we achieved in this patient. So this kind of patients always require not only surgery, expertise hand, expertise skills and planning also important. And these are a typical example of that such kind of patients and results. Kindly watch our videos to get more information on hair transplantation surgeries and results. So what is the conclusion of such kind of challenging patients is Most of the times, at times maybe they would need a second session also. Fortunately, this patient had enough grafts and would achieve the best results in one session. There are some guys having a extensive hair loss or ongoing hair loss, probably would need a second session. If someone has already lost more hair, they would definitely need a second session. So kindly note, this kind of planning and results may not be possible in all the patients. It is possible provided medium sized scalp, provided best donor, provided with your best expertise doctor with you with the best plan. I'm sure surely it would give you a reasonably remarkably best outcome like these patients. That's the conclusion of challenging hair transplantation results. Thanks for watching.